Impetigo in children, signs, causes, and treatment. Imagine your child coming home from school with a small, seemingly harmless scratch. A few days later, that scratch has turned into a red sore that's oozing and has a yellowish-brown crust. It's itchy, it's uncomfortable, and it's spreading. This is the reality of impetigo, a common and highly contagious skin infection that primarily affects infants and children. Welcome to our channel, where today, we're going to delve into the world of impetigo in children, signs, causes, and treatment. Impetigo can be a scary experience for both the child suffering from it and the parents trying to treat it. But with the right knowledge and tools, it can be managed effectively and even prevented. In this video, we'll guide you through the signs of impetigo, what causes it, and how it can be treated. We'll provide you with the information you need to identify impetigo early, understand what's happening, and take the right steps towards treatment. Knowledge is power, and when it comes to your child's health, it's no different. So let's get started and learn more about impetigo so you can be prepared and proactive in protecting your child's health. Let's understand the signs of impetigo. Impetigo is a skin infection that manifests itself in a very distinct way. It typically begins as red sores or blisters that appear around the mouth, nose, hands, and sometimes other parts of the body. These sores are not just a visual concern. They can also cause discomfort. They may itch, and when scratched, they can spread the bacteria to other parts of the body and to other people. One of the key characteristics of impetigo is that these sores can burst open after a few days, leaving behind a raw red patch on the skin that oozes fluid. This fluid contains the bacteria causing the infection, which is why it's so important not to touch or scratch the sores. After the sores burst, they quickly develop a honey-colored crust. This crust is often described as stuck on, as it firmly adheres to the skin. Over time, the crust dries out and eventually peels off, revealing a red mark that gradually fades without leaving a scar. It's important to note that the signs of impetigo can vary depending on the type of impetigo. Non-bullous impetigo, the most common type, causes sores that burst and form a yellow-brown crust. Bullous impetigo, which is less common, causes large, painless, fluid-filled blisters. Impetigo is primarily caused by two types of bacteria, Staphylococcus aureus and Streptococcus pyogenes. These aren't alien invaders, but bacteria that are often found on our skin and in our environment. However, when they find a way into the body through cuts, scrapes, or insect bites, they can cause an infection, leading to impetigo. Children, with their boundless energy and curiosity, are particularly susceptible to impetigo. Their still developing immune systems may not be fully equipped to fight off these bacteria. Plus, their active play often results in minor skin injuries, providing an entry point for the bacteria. But it's not just about the cuts and scrapes. Impetigo can also spread through direct contact with the sores of someone with the infection or with items they have touched. That's why it's common in settings where children are in close contact, like schools and daycare centers. So, you've spotted the signs of impetigo and you're wondering, what now? Well, don't worry. We're here to guide you through the next steps. Firstly, let's talk about the superheroes of this story, antibiotics. These mighty warriors are usually the first line of defense against impetigo. They come in different forms. Some are creams or ointments that you apply directly to the sores, while others are medicines that your child can take orally. But remember, these superheroes need to be prescribed by a healthcare professional, so make sure to consult with your child's doctor. Now, while antibiotics are fighting the bacteria, there's something very important that you and your child can do. Maintain good hygiene. Think of this as your secret weapon in managing impetigo. Encourage your child to wash their hands regularly with soap and water. This simple act can help prevent the spread of bacteria. But what about the sores? Well, it's important to avoid scratching or picking at them. I know it's easier said than done, especially when they're itchy. But remember, scratching can spread the infection to other parts of the body and even to other people. So try to keep those little hands busy with other activities. And lastly, keep the affected areas clean and dry. You can gently clean the sores with mild soap and water, and then pat them dry. Covering the sores with a bandage can also help prevent scratching and spreading the bacteria. So there you have it, the battle plan against Impetigo. With antibiotics, good hygiene, and a little patience, you can help your child recover from Impetigo and prevent it from spreading. Remember, every step you take is a step towards better health. If your child has Impetigo, it's important to keep them home from school or daycare until the sores have healed and are no longer contagious. Be sure to inform their teachers or caregivers about the condition to prevent its spread to other children. In some cases, Impetigo may resolve on its own without treatment, but it's always best to consult with a healthcare professional for proper diagnosis and guidance. Remember, early detection and treatment are key in managing Impetigo and preventing complications. If you suspect your child may have Impetigo, or if their symptoms persist or worsen, don't hesitate to seek medical advice. By staying informed and proactive, parents and caregivers can help their children recover quickly and prevent the spread of infection. It's crucial to follow the prescribed treatment plan and maintain good hygiene practices to prevent the spread of the bacteria causing Impetigo. Remember, if your child has Impetigo, it's important to keep them home from school or daycare until they're no longer contagious, usually 24 hours after starting antibiotic treatment. Always consult with a healthcare professional if you suspect your child has Impetigo. We hope this video has been informative and helpful in understanding Impetigo in children, its signs, causes, and treatment. Your child's health and well-being are always our top priority. Thank you for watching, and we look forward to bringing you more informative content in the future.